Yesterday, the state reported that over 11,000 individuals were tested for COVID-19. In total, about 1.2 million tests have been administered to date. Yesterday, there were 172 new positive cases reported. That brings the statewide total of positive tests to 105,629. The 7-day average for the positive test rate remains at about 1.7%. That positive test rate has dropped by 94% since the middle of April. We saw similar numbers overall across the weekend with respect to hospitalizations. There are currently 583 patients who are hospitalized for COVID-19 statewide, and 93 of those are in the ICU. The 3-day average of patients in the hospital is down by about 85% since the middle of April, and as of yesterday, 2 hospitals were operating in surge capacity, but it was not related to COVID. It was related to other issues, if I'm reading the report correctly. Yeah. We obviously remain focused on these metrics as we continue to contain and fight COVID and work to gradually reopen the Commonwealth. Today, Boston will start Phase 3 in the city of Boston. With more activity, we'll continue to work with them to urge residents everywhere to continue to be mindful and vigilant. It's only because of the hard work and the commitment and the diligence and dedication that so many people here in the Commonwealth have put into their individual opportunity to stop the spread that in many ways we've been successful. Wear face coverings when you're indoors or when you can't socially distance, practice good hygiene and hand washing, stay home if you're feeling sick, and contact your healthcare provider if you experience symptoms. We're very glad that so many people over the course of the past 120 days or so have taken advantage of telehealth. It's turned out to be a terrific way for people to stay in touch with their providers on a regular basis over the course of the past several months without having to engage in face-to-face contact. I think in many ways that is one of the most positive developments of this whole ordeal, and I certainly hope that we continue to have telehealth available to people as we go forward. I'll close just by saying on this particular part that COVID is not going to take the summer off, and our success in slowing the spread and containing the virus will continue to depend on the efforts of all the residents here in Massachusetts who have been so terrific in stepping up and dealing with this over the course of the past several months. I do also want to say that our success on the reopening piece will be driven in many ways by compliance with the workforce safety standards that have been developed by Lieutenant Governor Polito, the Reopening Advisory Board, and so many of our colleagues here in Massachusetts in the public health and healthcare space. We're grateful that thousands of businesses and organizations are doing their part to implement the reopening guidance that's been made available. People are working hard to cooperate and be creative. But if folks believe that a business or an employer is not observing the safety guidelines, we've set up a process for people of the public or employees to reach out and communicate that. Today we're launching a new website, mass.gov/compliance, to provide easy access to the tools that you need to submit a report of noncompliance. Starting today, callers to the state's 211 COVID-19 hotline can report issues that will be directly moved to this webpage. Investigations can result in enforcement measures if violations are discovered. Just want to say again that we know everybody's working hard to be safe and create the best new normal we can with COVID-19, and we are deeply grateful for the cooperation of our employer community and so many others, and we hope this tool can help promote accountability as we continue to reopen Massachusetts. Now, with respect to today's announcement, it's related specifically to our special education residential school providers who have stepped up in a big way over the course of the past several months. We're here today at the New England Center for Children for just that reason. The Commonwealth's special education residential schools do tremendous work educating and supporting students with special needs. Throughout the pandemic, special education residential schools like this one have remained open. Again, I want to thank Vinny and the team and so many of the folks who operate in this community for the work that you've done to ensure that kids continue to be served during extremely difficult circumstances. The ability this community has shown to adapt, to maintain a safe environment for students in their care and for their 24/7 staff has been a godsend. Now, Schools incurred unanticipated costs that were related to the purchase of personal protective equipment, infection control measures, increased staffing costs, and enhanced cleaning protocols over that period. We know this was difficult work, and we know that so many people, time and time again, found a way to simply get it done. The virus has caused changes in respect to everyone's existing routines, and we know that these changes have been particularly disruptive for individuals with special needs and particularly stressful for their families. Today we're announcing a $16.1 million relief package for 32 special education residential school providers to support costs that are related to COVID-19. The New England Center for Children, for example, will receive almost $2 million of this funding. Earlier in the response to the COVID-19 pandemic, the Executive Office of Health and Human Services authorized $139 million in funding for residential and congregate care service providers. Those funds were used to increase staffing, enhance infection control procedures, and purchase and acquire personal protective equipment. Due to the structure of the special education residential schools, for a variety of reasons, many were not eligible for this earlier funding round. But today's announcement brings them in line with the previous increases that were provided to other residential and congregate care providers earlier in the year. And as we prepare to move forward and bring kids back to school in September, the Department of Elementary and Secondary Education has released comprehensive guidance for special education, including schools like this one. DESE also released extended school year guidance to allow for special education day programs to open now. We're grateful for the collaboration between special education community and the administration and local communities as we all continue to develop guidance and work together to keep students safe and ensure that they continue to get the education that they need and deserve.